I've got 5 minutes, so fasten your seatbelts. This is going to be a bumpy ride. Why hasn't Ampligen been fast-tracked? It's been over 20 years, and I have been on it 9 out of the past 12. There's no known major toxicities. There is nothing else out there like it, and there's a whole bunch of us it helps. Oh, must not be a serious enough illness. Why does NIH spend less than 1% on us of what they spend on multiple sclerosis? Now, multiple sclerosis isn't overfunded, but it's a serious disease. We don't have a serious disease. Why are 850,000 of the 1 million Americans with my disease left undiagnosed 25 years later? As many as 250,000 people may have the disease as seriously as I get it, which is I become bedridden. Where are they? They are left to suffer in isolation and poverty, and you've already heard today that includes kids and teenagers. Why? Why is this being allowed to happen? Somebody is sending the message that this is not a serious disease. And it is my sad duty today to say that that's mainly the U.S. Centers for Disease Control and Prevention. Now, in their report, CDC checked, yes, for working on biomedical research on CFS. No, they're not. And we don't even want them to do that. We want them to put forward biomedical information on CFS. Here's an example. Everybody at that NIH workshop was enthralled about the VO2 max stress test and the results. You're not going to find that on the CDC website. Here's another example. 17 years ago, in the 1994 article introducing the definition most used for CFS research, Dr. Fukuda charged CDC with finding homogeneous subgroups using biomarkers. I am part of such a subgroup. I'm not on that website either. But my subgroup fits the North Tahoe cluster outbreak. Bob's part of it. We got the same biomarkers. Some of us have more, some of us have less. But it's a pattern. Dan Peterson knows how to diagnose this, and there's other people around here who have other biomarkers and things they use to diagnose this. This is not as mysterious a disease as the CDC website makes it out to be. When off Ampligen and in relapse, I have the following biomarkers. So does Bob. 37 kDa RNA cell defect, virtually non-existent natural killer cell function, abnormal cytokine pattern, abnormal SPECT scans. My VO2 max score is horrendous. When I relapse, first I get Epstein-Barr, then the rest of my viruses become active and stay active, and some go in my spinal fluid. HHV6 variant A, HHV7, cytomegalovirus. These are serious diseases, and they're active in my spinal fluid. Not at the moment because I've been on Ampligen. On Ampligen, the biomarkers recede and the viruses go dormant. For me, at least, I get better. You're not going to find that on the website. Oh, yes, you are. There's a paragraph on the website. It says, I quote, "A number of tests, some of which are offered commercially, have no demonstrated value for the diagnosis of CFS. No diagnostic test for infectious agents such as Epstein-Barr, enteroviruses, retroviruses, human herpes virus are diagnostic for CFS, so they should not be used. No immunologic tests, natural killer cell, cytokine, cell marker, tilt table tests, SPECT scans, pathway markers, because they can't be used to diagnose CFS. That's the wrong standard. You are supposed to be using these tests to diagnose subgroups, and then those subgroups can be studied and treated. And in fact, you could be treating people right now. You could be diagnosing them, you could be finding out what's wrong with them, and treating them now, and then leaving the ones who can't be treated to be studied for something else." I have a second question. Why does the CDC pay so much attention to Peter White, a British psychiatrist who thinks this disease is caused by inappropriate illness beliefs and that cognitive behavior therapy and graded exercise are the cures for it, and not the Dan Petersons of this country who have been dealing with patients and treating them and finding out what's wrong with them? Dan only uses stuff that's published in refereed journal articles. This isn't experimental. This is there. It's been out there, some of it, for 20 years. It can be used. It should be done. I want to say one more thing about our friend Peter White. Okay. Why is there so much disinformation on CDC's website? That's because there are people at CDC that's been listening to the British psychiatrists, and the British psychiatrists are working for insurance companies, and we have that now as hard evidence. Peter White, who reviewed the 5-year plan for CDC, was chief medical officer of Scottish Provident Insurance Company and Swiss Re, a multinational reinsurance firm at the time. And if you don't think he had input, look at the little place where he says, oh, they're doing biopsychosocial research, they're doing a good job. That's Peter White. There you have it. I believe CDC's program and CFS has been bought and paid for by insurance companies for their benefit, not for medicine, not for science, and certainly not for patients. The reason I can't get Ampligen at home, the reason there's no funding for us at NIH, the disinformation campaign on CDC's website, all of it is the product
Please wrap up, Mary.
institutionalized gender bias pushed by insurance companies, and it has to stop. You need to throw that whole program out and start with the truth. Most patients can be diagnosed now with something and get improved in some way, and they should be. We need to use immune drugs like Ampligen, gamma globulin, interferon, antivirals like Vistite, Valtrex, Valcyte, new drugs in development, new ideas. There are things we could be using. And if CDC won't do it, I ask Secretary Leavitt and CISAC to do it, because I would like this to change before your children or my 7-year-old granddaughter are the next victims. Thank you.